I've been promising a video for a while. It's been over a week since my last update. I focused last week on Utah, and this week I'm going to start on Texas, Houston. The same kind of panic that's taking place in Utah is happening across the country. KHOU 11 reports the occupancy rate of ICU beds in Houston at 97%. Actually, what's nice about this article is that it helps put things into context a little bit at least. There's no reason to panic. They say themselves that what happens normally in hospitals, they're at their full capacity, and when it gets crowded, they add additional bed. So this is not anything unusual. So there's not a reason to panic. We can see, based on these numbers, that ICU bed utilization in Houston is about 35% of COVID-19 patients. Keep in mind that just because they're COVID-19 patients doesn't mean the reason they're in the ICU is because of COVID-19. People can be in the ICU and get infected by COVID-19, or people can be in the ICU with COVID-19 but have a completely different illness. So even this 35% doesn't necessarily mean that COVID-19 is causing this utilization. But anyway, there's a plan in Houston. One of the takeaways from this article is there's not a reason to panic. Here's something funny. I'm going to talk more about this, but here they say we're 4 times more likely to get COVID-19 now than we were back in May and April. So absolutely, yes, 4 times more likely to get COVID-19. The panic in Houston was so bad that they actually had to create a video explaining their plan, explaining why 100% capacity is really not anything to panic about. And you can go and read these articles yourself. Here's a judge in Harris County who is reading the same information and decides the timing is suspect. I find it very, very problematic. We do not need to be misleading people. This is a problem, misleading people. Why are they misleading people? Ask that question. What is it they stand to gain? Let's move on a little bit. I love this. Mainstream media goes all in with panic porn over COVID-19. This is exactly what it is, right? Panic porn. People are addicted to this, and I don't understand it. Here's a former New York Times reporter, Alec Berenson. Mr. Berenson, down here, he looks for the facts. What are the facts? Facts are important. Mr. Berenson reaches out to and gets a message from J.B. Neiman, who is a managing partner and general counsel, in other words, an attorney for a Texas-based healthcare company. Mr. Neiman is being quoted here in this story. Going back to this first article that I referenced, it said we're 4 times more likely to get COVID-19 now than we were back in May and April. We? Who is we? That's the question to ask. And here we learn from Mr. Neiman, positive rate now is higher than it was back in May. 20% compared to the 4 to 6%. So yeah, that's 4 to 5 times more likely to have COVID-19. Except, here's the key. Who's testing positive now versus back in May is a very different patient than we've seen before. So what's different about these new patients that are being diagnosed with COVID-19? Here's one giveaway. Average age of people getting tested now is in the mid-30s. It's a very different patient in terms of age. Most of these patients aren't already sick. They weren't already in the facilities because previously we didn't have enough test kits, is what this article says. What are some other things that have changed? The vast majority of the patients now are better within 2 to 3 days and can be described as having a cold. Guess what? The coronavirus historically is a virus that is responsible for 50% of the common cold cases. Is this a shock or is this a surprise to anybody? No, it's not. Also, why are they going to the hospital? Well, they're going to the hospital because their employers are forcing them to. A lot of these infections are people who have mild symptoms who normally would not go to the hospital. If there wasn't COVID panic happening, these people wouldn't go to the hospital for the symptoms that they have. What's the real reason why ICU beds are filling up? He tells us right here. Mr. Neiman says that they're filled with really sick people with non-COVID issues. Why hadn't they come in previously? Well, because the panic, the fear that was instilled in them caused them to stay home. But now they're going in. Remember, I asked the question, why? What is the motivation for these things? Well, Mr. Neiman here tells us he's heard several stories of how discharge planners are being pressured to put COVID as primary diagnosis. Well, why would they put that? Pays significantly better. Here's another factor we don't consider. You open up your hospitals for normal medical care. Now, you're testing everyone that comes in. Let's talk about panic here again. Dr. Anthony Fauci, who we all know who he is, he has a lot of attention in the media. He's the White House coronavirus advisor, all these things. Why in the world would he be out in front of the nation talking about an obscure strain of a virus that is not even affecting humans yet, and do it now? This is important because it helps them continue to keep the people, keep you in a panic mode so that they can continue to push whatever social agendas that these people have. I don't know what they are, frankly, but I think it's irresponsible. Why in the middle of a current pandemic would you do this? Now we're going to move on to Utah because I'm in Utah and I have the best data and most information about Utah. So in Utah, this is interesting. They find that most residents are highly susceptible because what they've done in Utah, they tested 8,500 random Utahns, and what they found is that the infection rate, meaning those with antibodies in Utah, are actually much lower than anticipated. Shocker, they're much lower. We have been forcing people to stay in their homes to quarantine, and then we're surprised to find there are less people infected than we thought. But here are some interesting things, even out of this, right? The CDC estimates that there are about 10 times more cases than those that are diagnosed or recorded generally. This study finds that there are about 2.4 additional cases per detected case in Utah. But still, we go to the bottom of the article, the very bottom, we see here that in Utah, the mortality rate among those who have tested positive is 1%. And by the way, that's the lowest in the nation, apparently. 2.4 times more individuals are anticipated to have the virus. So if you look at this 1% number, what that tells us is that in Utah, the actual mortality rate from this virus is well under 0.5%. They don't tell you a little important piece of information as well. The numbers are heavily slanted towards those who are elderly and sick. A couple of other things I wanted to mention here. We've looked at these charts. This is today, which is as of Friday, July 3rd. I'm going to compare these numbers to the numbers from the last video. So here today, we have 186 total cases of COVID in hospitals in Utah. Remember, my last video was over a week ago. So 186 total cases in Utah, in hospitals. Keep that in mind because on June 29th, well over a week ago, that same number was 193. Yeah, our hospitalization rate, percent of non-ICU beds occupied, 48% on June 29th, 52% yesterday. Well, that's obvious that it's not COVID patients. There are other patients who are also utilizing hospital beds. But basically, we can see here, simply looking at this chart, we had confirmed cases in hospitals. They were going up, trending up for a while. But now we can see here 186, 184, June 26th is the date that we had 189. So look at those trends. They're not alarming. Despite the fact that trends not alarming, here's how the news in Utah reports this information. 596 new cases. Again, 5 more deaths. We look at the details of the deaths, and here we see every single one of those deaths in Utah are people, it's unfortunate, yes, but these are people that are living in long-term care facilities, every single one. If those who are contracting the virus are in the healthy or low-risk category, let's look at that here real quick, low-risk category. So we can see in Utah, again, if you are in between the ages of 25 to 44, 92.2% of those infected do not need hospitalization. As you get older, right, 45 to 64, now 86% of this demographic doesn't need hospitalization. As you get into this, 72% of this category doesn't need hospitalization. Clearly, if we can get these people to help build herd immunity, we'll be right on path to where we need to be. So if we go to the bottom of this, again, all this stuff is important to understand. And so even down here, we can see that 95% of deaths in Utah from COVID or with COVID, we don't know if they're from COVID, are high-risk individuals. There is not a reason to panic. I'm not having a face mask debate here. What I am saying is that we should all be living our lives using common sense. If you weren't washing your hands before, shame on you. Wash your hands. If you were getting in people's faces and spitting on them before, well, stop that. Why would you do that anyways? Stop those behaviors. Give people some space, wash your hands, and be cautious around your grandparents. Simple formula. That shouldn't be a new normal. That should have been your normal. Keep making it your normal. If you found this helpful, informative, please go ahead and share it. Subscribe to my channel. I do my best to share only factual data with you and to rationally analyze that information. If you have comments, please go ahead and make them below and I will try to respond to you. And if you have any suggestions on something you'd like a video about, go ahead and comment that as well. Thank you.